Good afternoon, everyone. We are going to wait a couple of minutes to allow more people to enter the webinar. All right, well, good afternoon, buenas tardes. Welcome, bienvenidos everyone to our fifth installment of Pandemia, the series of webinar about the COVID-19 pandemic and the COVID-19 vaccination efforts among Latino community. My name is Luis Alberto Mares. I am the Director of Community Mobilization Programs at the Latino Commission on AIDS, and I have the privilege and the pleasure to be here again with you as a host and moderator for this webinar that is going to bring you important information directly from experts in the field of medicine and public health for the Latino community. Today's webinar is brought to you through a collaboration of 3 organizations, the COVID-19 Prevention Network, a network of researchers, institutions, and medical providers who are working to find safe and effective vaccines for COVID-19. The Latino Commission on AIDS, with over 30 years of work trying to improve the health of the Latino community in the United States, and Unidos US, a trusted non-partisan voice for Latinos serving the Hispanic community through research, policies, analysis, and advocacy efforts. Today's webinar is titled Challenges with COVID-19 Vaccination Among Hispanics. In this webinar, we will review new and updated information about COVID-19 vaccines. We will also touch upon the availability of vaccines for the pediatric population. This is new information we haven't touched on yet in our previous webinars. We will discuss as well about the challenges that the Latino communities are facing in relation for the COVID-19 vaccine rollout, the importance of engaging this community in COVID-19 vaccination, the efforts that community-based organizations in New York City and Washington, D.C. are doing to disseminate actual and current information about vaccines, and the implications of local and federal government efforts in vaccine equity. For this webinar, we have 3 presenters, panelists. We have Dr. Ligia Peralta, CEO at Casa Rubén in Maryland and MIT Sloan Fellow and Researcher. Guillermo Chacón, President of the Latino Commission on AIDS and founder of the Hispanic Health Network, and Alejandra Jeb, Health Programs Director at Unidos US. At the end of this presentation, we will have some time for questions and answers. So at this moment, I would like to ask you to please mute your mics if they haven't been muted automatically yet, and to write all your questions and comments in the Q&A box. If the webinar is being recorded, no, it has to be recorded. Record. It's being recorded. And the recording will be shared with you after the webinar is finished. This webinar is also being live streamed on the page of the Latino Commission on AIDS at Facebook. So now we'll begin the presentations. Let me stop sharing, and we'll. We begin the presentations with Dr. Ligia Peralta. Dr. Peralta is a clinician scientist, fellow of the Massachusetts Institute of Technology, and president and CEO of Casa Rubén INC, an organization addressing health disparities in underserved communities. Dr. Peralta is an active member of the HIV Vaccine Trials Network and co-chair of the Latinx Committee of the COVID-19 Prevention Network of the National Institute of Health. Currently, she leads a new initiative addressing the needs of individuals recovering from COVID-19. Dr. Peralta will touch on the medical aspects, new information about the COVID-19 vaccines, new strains of COVID-19 in relation to the vaccines, duration of immunization, and will inform us about the vaccines in the pediatric population. Ligia, welcome and thank you.
Thank you so much. And it is a wonderful opportunity to share with Luis and Alejandra, and of course with Mr. Chacon. We have done HIV/AIDS work for a long time, and many of us have responded to this pandemic because of all of our work with the community. So I describe myself as a physician scientist deeply involved in the community and taking health resources to the community. This is what we have done in the field of HIV in the past, and also, done the clinical trials where people are. So I have learned from this pandemic a great deal about humility and even more about social justice. Because we are now in the community, and we know with that lens that things look very different for our own people. I have a lot to cover today. I'll try to be fast and cover some of the news, what we know, but without forgetting what are the basic elements, and talk a little bit about the new variants and also the research in the pediatric population, which is, very important. So allow me to share an experience that just happened to me 2 days ago while I was driving to work. Since I'm so embedded into the community with our services, I received this urgent phone call from a family of 4, 2 adult parents in their 30s, the 11-year-old girl and an infant of 15 months. The infant had been sick for 2 weeks with vomiting, diarrhea, had basically 5 emergency department visits and 1 admission to a children's hospital for vomiting and diarrhea, and of course dehydration. And when you have a sick child, not only you need help, but the mother also got symptoms and end up calling grandma and relatives to come and help. And the urgent phone call was that they all tested positive for COVID. And we are talking about 2 days ago, but this is a common example in our Latino families. This is what we live every day, that someone has to go out there and work as an essential worker, and then everybody else gets, COVID-19. But imagine the pain and the suffering and the guilt of this family, and trying to identify who was. Everybody was healthy. There were no underlying conditions here, and they were protecting themselves. So where did this come from? And this is one of the issues in our community where the baby and the mom suffer the most. They were both hospitalized, but despite everything that they did to make sure that they were protected, someone got infected. And this is what's happening now with the new variants. And that's why we are going to touch bases on that. No matter how healthy you are, no one is immune to COVID. This is what this family learned the very hard way. And with this family in mind, I want to bring 2 concepts. One is that we are trying to move from the very sick, like you see in this picture. This is, by the way, my brother who works with COVID, and he's an intensivist and a surgeon operating on someone with a trauma on COVID. We are trying to move from that to doing the care in the community, which is what is needed. And also we are trying to move from the very, very high risk elderly, which we have been more successful at immunizing, to now the general population, especially our people. So I'm going to touch a little bit on that and some of the challenges we are facing in the community. But the other concept is the clinical concept. We all have heard the news and there's so much information, but we forget that over half, 50%, more than 50% of the transmission come from people who have no symptoms or have symptoms after the fact, after the family has been infected, which this is the case. And imagine how everybody feels about having 2 people in the hospital. There's a great deal of guilt. But one of the things that we forget, and you can please, Luis, pass the next one, is that we didn't learn at the beginning, and look at that blue arrow right there, that before we test positive for COVID with a PCR, before being sick, one may have no symptoms whatsoever and no positive test. That's what happened to this baby. On day number 2, he was admitted to a children's hospital. They did the PCR testing, but there was not positive yet. So you have that little window there where that arrow is, where you have no symptoms, there are no positive tests, but you are highly transmitting this virus. And that's where young people also come into the equation, because they are very, very, they socialize very well. They like their family, they like other children. So this is one of the areas where you see a great deal of transmission, and many people don't know it. The same thing happened with adults. So the second clinical concept is not only that you may have no symptoms and be transmitting, but the second one is that when healthy people have COVID, they may think that nothing else is going to happen. Perhaps they had some symptoms and they developed their defenses and they are well now. But you still, in those individuals, could have what we now see as post-COVID-19 syndrome, which is one of our initiatives in the community. Why? Because now you have people with some symptoms that they can't explain. For example, mother or father, now they are not doing well within the family. They are not tolerating things very well. They feel like they don't want to go to work. They can't concentrate. They have foggy thoughts. Before they could multitask and do 2 or 3 things, now they feel tired, and at the same time, they have difficulty getting back to work. That's what we call the post-COVID syndrome and the third wave. And those symptoms could linger for a little bit. And this is what I tell people: we cannot predict right now who is going to be in that category. And this is what this family is going through right now, that not only they had the impact of having 2 people sick in the hospital, but now some of those members are also having those symptoms that are making this disruption even greater in that family. And what we are calling now the fourth wave is that the hardship of this family, financial, losing jobs, missing jobs, the kids missing school, no babysitting. There is a great deal of pain and suffering that happened, and this is what we need to also address. And that's why we think that when you're healthy, there is a way to think about that vaccines are a tool that in epidemiology, and I'm a pediatrician by training, are very, very strong tools to be able to block the virus. We have tried the behavioral way, and sometimes we have failed. Like this family, they tried the best that they could, but now we have new variants and they are spreading a lot more. But vaccines are able to protect us in a way that we don't have to think about all these details necessarily on how to change behavior, or we can guess who's infected or not. So if you can pass the next one, please, and the following one. So how vaccines work. When this is just a graphic where on the left side you see the coronavirus, and you see these spikes. This is the famous spike protein. There is a lot more complex than when we see it in cartoons, right? But that protein is really what attaches to the cell. And if you can pass the next one, you can see how they basically hold hands, right? So that is the way that the virus penetrates the cell and replicates. So the virus is really, the function of the virus is entering the cell and replicate, because it's the survival, right? It has to replicate and it has to go into the cell. So what happened with the next slide is that what we see is that we would like to have antibodies or defenses in our blood to do not allow, to avoid that linkage between the virus and the cell. So if we stop that, then the virus does not replicate and basically it goes away. But antibodies is just one way how we respond to vaccines. The second way is that the vaccines also kind of are very special in terms of using what we call specialized cells, like the B cells, memory cells, other things that we have in our immune system to be able to fight in the long run. That's why when there are 2 doses of the vaccine, we need the second shot. And right now we have even up to 5 million people who are not getting it, like 8% of the population, for many reasons. And some of the reasons that we are hearing in the community, they not even knew what vaccines they had. But the indication is get that second dose as soon as you can, because those antibodies not only are there, but the second dose are going to enforce that antibody, make it more durable for a longer period of time. And at the same time, we're going to activate those cells that are very important to fight the virus and also to create more antibodies in the future. So it's very important that everybody gets that second shot. So let's go to the next one, Luis, if you may. So we have two types of vaccines, right? We know that they were approved through what we call the emergency use mechanism, but there were no steps that were, in terms of clinical trials, everything was done by the book. The only difference was it was more accelerated. Instead of waiting for phase 2 to finish, we just started simultaneously. But the main thing here is that safety has been the priority, like any other clinical trials. So let's talk about the two types of vaccines that we have in the market right now. The Pfizer and Moderna, most people, have received that, and the Johnson & Johnson. So the Pfizer and Moderna uses a genetic piece, tiny piece, which is called RNA, which serves basically as a transport to get into the body and delivers a message to the cell, just saying, okay, go ahead and make those proteins. So they mimic, what the virus, the proteins of the virus, and then we create antibodies in our own body. But many people are concerned, like, is this new? Well, it's new for this type of vaccines, but I come from a school, MIT, where Bob Langer has been part of the Moderna, for example, vaccine development. And his first paper was published in 1976 about this mechanism. The issue is that before, we didn't have the technology to make this RNA stable enough to be able to deliver this type of message. So once the RNA enters into the cell, it just gives the message and disappears. It's not that, it's complicated kind of to hear that this is a piece of genetic material, but the reality is this is just like transport, getting a recipe into the cell and indicating to the cell, go ahead and do your own business, right? So there are two important things about that. Number one is there's no chip that is being delivered to you whatsoever. Otherwise, none of us would have been immunized. And number two, there's no live particles of vaccines of COVID-19. So you don't get the disease. But also, it doesn't affect or interact your DNA. Remember what I mentioned, that RNA is very sensitive to temperature. Once it enters the body, does the job, and disappears. So it is very important to know that despite the fact that this is new for this type of vaccines, this is what we hope to have in the future to make sure that we get all the vaccines for complicated diseases. And remember, this platform has been used the same thing as the Johnson & Johnson with what we call a virus that doesn't produce any disease. It's just like a cold virus for human that doesn't produce any disease and does the same job. It's like a transport, right? However, the important thing is those platforms have been used before. For example, RNA has been in research for other vaccines like Zika and things like that, that we needed to have some kind of response. But now we got the technology to the point that we can use the RNA to deliver the message and then disappears. So let's go into the past, and this is the next one, if you may. There are two things that I want to mention before going into Johnson & Johnson. One is that there is a great deal of concern about fertility. And why we are hearing that now, because remember, we were immunizing people who were older. So they didn't have those kind of concerns, but the young people do. And now I go out to the community and young men come to me and say, well, I'm not sure, I may not have babies in the future. And I say the same thing with the young women. In a family, the parents may want the vaccine, but the younger ones who are 18 and older, especially those who are at that age, 18, 19, they have a great deal of questions about fertility. And one of the things that is important to notice is that there are no studies whatsoever that have linked these vaccines, none of them, to fertility problems. In fact, there was a paper from China looking at changes in the period for young women who had their vaccines, by the way. And every woman knows that the periods are could be like a clock, but not necessarily the bleeding. The bleeding changes for many things, the same as when we get the periods. There were a little bit of lighter periods of some of the participants, but it was not significant enough. And in the United States, we have not been able to prove that. And there's really nothing in the vaccine that produces fertility issues, although CDC is looking carefully into those concerns. The other thing is about, and I think it's important to mention the religious concern about the cells, specifically for the Johnson & Johnson, the cells being used for the vaccine production and then, the testing being morally compromised because they original in the 70s cells were from aborted fetus, right? So what we know is that those cells, or the cells that are being used now, are clone cells. And in fact, even the Vatican has really stated clearly that they do not consider that those cells are morally compromised because even in the Johnson & Johnson vaccine, the remote connection is so far away that they don't consider this an impediment for vaccination. And that's important because if we don't address that in our community, and this is what I see day by day in our Latin community, these are some of the issues that we need to really address head on. So let's go into the safety of the vaccines and the efficacy. And I'm just going to go quickly for the vaccines that we have, the 3 Moderna, Pfizer, and Johnson & Johnson, into the protection from death and from very severe disease. We know that the protection is very good, even in the clinical studies with the Johnson & Johnson, up to 85% from having severe disease. These are incredible numbers. For many of us pediatricians who have worked in the field for a long time, we hardly see vaccines at 90% effectiveness. I mean, this is really very, very good numbers. But the other part of that is that we now understand that Johnson & Johnson had a pause. It came from the FDA, came from the CDC altogether. And why that pause? Because there were rare cases of clots in women from 18 to 48. There were 15 cases in total after looking at the data, but they looked basically at, what happened to these cases is clot in individuals who had low platelets, and the platelets are the ones that aggregate to be able to stop the bleeding, right? And these cases, what happened is that instead of going forward, the safety was number one for the government, and they decided, let's pause that, do 2 things. Look at the data, and the data is on VSafe that everybody who gets a vaccine could read and log into that. And then the VAERS, which is where you can report as a patient or as a clinician, anybody in the community, what happens to you when you get a vaccine. And they look at that carefully, and the second thing they did was to educate us clinicians about how to manage these rare cases. Remember, 1 in more than 1 million. So 15 cases in total for millions of vaccines. So this is very important because now we have a warning for women who are in reproductive age, but also if they are concerned about clots at all, they could use the other 2 vaccines that are available. But we do have a very good system to make sure that not only the efficacy is taken in consideration, but also the safety. So the next one, let's go to the variants of concern. Why are they, and Luis, the next one, why are they of concern? For 2 reasons. Because they spread so quickly. Remember the case that I just told you 2 days ago? They spread to the entire family. Before, maybe we saw, half of the family. When I tested the other half, they were maybe, they had not acquired. But in this case, everybody got the COVID-19. And then the second concern is, in addition to being so fast in terms of spreading, they could evade immunity. So the good news, if you get the infection, for example, because you have a variant like this, and there are just, a report from the CDC and a report that just came out in the New England Journal of Medicine from Rockefeller University, even fully vaccinated, if you get the infection, it's not that common, but also you recover because you have the antibodies necessary to do so. So let's move to the next one. Luis, please, and then the next one. So pregnant women are eligible to be vaccinated. And again, there's a new study in the New England Journal of Medicine that tells us that this is very important, especially once you in the last trimester, and you can give, if you are lactating or you get it even in the last trimester, you could get the antibodies to protect the baby. But let's talk about children, because this is what I think is the good news. Children are a very large percentage of the population, but when we looked at infections, and remember, we're not testing every child, the tests confirmed cases were like up to 13% of all the US cases. So it's not like it was rare, but if we were not testing enough, because many of them, especially from ages 6 to 16, were not having so many symptoms. But they got hospitalized, like the baby that I mentioned, and we are seeing more and more now with the new variants. But the death is really what is concerning a great deal, because when we talk about racial and ethnic minorities, we see that up to 66% of those children from 0 to 4 were passed because of COVID. And the same thing when you look at the 5 to 17 years of age. So that's why it's so important to do the research. And for the next slide, and one of the areas that we are very excited about and very grateful to the parents who are taking their children to these clinical trials is that, we go into phases. Now we're doing the adolescents that the trials are already finishing up. And that is where we see the Pfizer and Moderna from ages 12 to 15-year-old for the Pfizer. Remember, the Pfizer is already approved above 16, and then the Moderna 12 to 17. Both companies, Pfizer wrap up their trial, and they have 100% point efficacy reported as of last month on the 31st. And they are taking this for emergency authorization now in April. And we hope for Moderna to have this emergency authorization presentation for May. And remember, not only at the FDA level, but then in the next phase, which is the CDC and that external panel of people who are involved in science and community for a long time, that's where the approval happens. But this is extremely important, especially in communities of color who are suffering a great deal. And next, so just the next one, Luis, please. So to wrap this up, like I mentioned in the case that I presented, this family suffer a great deal unnecessarily because of the lack of access to immunization at this time. So I congratulate my co-presenters for doing all the work in the community, even at a national level, to make sure that our people are immunized. But at the same time, we know that COVID-19 vaccines efficacy and safety continues to be a big priority, and that vaccines maximize the benefit, even if you're healthy, to your own family and society, and that we are excited about hearing the results from the adolescent trials. And with that, I pass it to you, Luis.
Thank you very much, Ligia, for sharing information on children and that we haven't had before, and for sharing that experience with you, with the families, and the feelings that they go through after having people living with COVID. So now we're gonna follow with Alejandra Jep. Alejandra, I'm gonna put your presentation. Share screen. Share. Please. Okay, Alejandra is a seasoned bilingual public health professional with expertise in training and community engagement, program management, and strategic planning. She's currently working at the Unidos US, formerly known as National Council of La Raza, the largest national Hispanic civil rights and advocacy organization in the United States, as Health Programs Director for Training and Engagement. She will touch on the Unidos US program on COVID-19 vaccination, Esperanza, Hope for All, COVID-19 relief and recovery, the social point of view of the COVID-19 pandemic, and COVID-19 vaccination rollout, vaccine hesitancy and fears to get vaccinated. So, Alejandra.
Thank you. Good afternoon, everyone, and thank you to Dr. Ligia Peralta. What an amazing presentation. Thank you. I have to confess, I had the privilege of have seen this presentation, and every time she delivers it, she does it in such a way that enhances my understanding. So I'm sure it did the same for you. So thanks again to the Latino Commission on AIDS for inviting me. It's truly a pleasure to be here. I'm going to talk a little bit about Unidos US response to this pandemic. We've been in this pandemic for over a year now, and we've been working literally day and night in our response. Our Esperanza for All is our new public health communication and outreach campaign. It's a $15 million investment to ensure the health, economic, and education recovery of the Latino community, with a major emphasis on vaccine equity. Very important. And it has been from day one that Latinos across the country have, there is equal access or distribution of the vaccine, and that access is so critical. You can go to the second slide, Luis. We are currently working under three major areas: health, education, and economy. I working in health, and in health, what we are attempting to do is to ensure that all Latinos across the country have access to trusted information about the COVID-19 vaccines and can get a vaccine. That's why I'm so grateful to Latino Commission on Aid for inviting me today to share the stage with Dr. Peralta, as well as Mr. Chacon. And our vaccine campaign is in part or in conjunction with our continued education around prevention education and testing efforts. As you can see, we work in health, education, economy, and you can go to the next slide, Luis, please. And we work in very close collaboration, or the voice of our policy and advocacy team is extremely important at the national level. Every single we do has a just lens, meaning that just lens is integrated in all policies and procedures for distribution and access to the COVID-19 vaccines and or treatment. Also, we have advocated and we continue to do so for transparency in processes, inclusion, safety, and accountability. Dr. Peralta mentioned earlier about the Johnson & Johnson vaccine, and what is important to understand about that is that the FDA and others, because safety is just so important. Trust me when I say that there has not been corners that have been cut to bring this vaccine to fight this pandemic. And I really encourage you to inform yourself, to do your homework, and to take the best determination for you. Then if we go to the next slide, you are seeing that our approach is 360, meaning we are working in different markets using traditional and social media. An important work, if we go to the next slide, Luis, is we are keeping ourselves fully informed. What I'm calling here is keeping us grounded. And who is keeping us grounded? All of you do. We have a large affiliate network of nearly 300 community-based organizations. We work in collaboration with important partners such as the Latino Commission on Aid, COVID-19 Prevention Network with Dr. Peralta and other physicians. And it's very important for all of us, for me as a professional working in health education and health promotion, to hear what I call the voices from the field. We are, when developing programs, we seek that community feedback. And just this week, we have in training trusted sources of information, this important question: what have you heard about the COVID-19 vaccines in your community? What do you consider is the most effective way to bring this information? So for all of you who have tuned in today, please, my email is at the end of the presentation. Feel free to reach out, and because it's very important we hear from everyone. Luis, if we go to the next one. I mentioned earlier that part in the previous slide, part of the work I've been doing for the last 2 months is designing and implementing a webinar and training series. The training series is for trusted sources of information, and promotores de salud, housing counselors, those working in financial capability. And they have asked us for, give me a script. What do I have to say or not to say. And this is just an example, and I'm going to tell you where you can find this information. And as a FYI, I'm going to train promotores de salud in the next 2 weeks. If your group is interested, let's talk, and I'd be happy to deliver training if possible. We have developed a number of resources under our Esperanza Hope for All campaign. Dr. Peralta mentioned about the microchip earlier, which was widely spread in WhatsApp. Reality is that there are myths, there are misconceptions. And when Luis sends this presentation, you can click in that link, and we'll take you to our main website. If you go to the next slide, Luis, please. Getting to know your audience is really, really important. For example, if your audience tend to be on the younger side and you know they are using Instagram, we have developed this set of videos, and that is my colleague there, where we answer questions about the vaccine. We do realize that any campaign has to be multi-approach. Some people get the information through Instagram, some radio and TV is a better venue. And for many of the audiences we serve, face-to-face tend to be the most effective way, because people can get answers to their questions and so forth. If we go to the next slide, again, if you have gotten the vaccine and you are dealing with a younger audience, if you've been vaccinated, please share your experience on Instagram and Facebook using our filter, and we'll email you the instructions. And you can go to the next slide, Luis. Part of the resources we have as well is question and answers to common questions. For example, if I have a chronic condition like diabetes or heart disease, can I get one of the COVID-19 vaccine? And the answer is there, and all these resources are available to you. I saw in the chat someone asked, I'm pregnant, I want to get the vaccine, but I'm so afraid. That is some of the answers we have among your resources, but I'm going to let Dr. Peralta answer that later on. We can go to the next slide. Then here are more resources. For example, another question that is often asked to us is why do I have to follow the prevention measures after I get the COVID-19 vaccine? The short answer is the pandemic is not over. We are doing better because we have vaccines to our disposal. But reality is the pandemic is pretty much alive. And if we truly are committed to go back to where we were at the beginning of 2020, we all have a role to play. And the best way right now is to get the vaccine. I already got my first dose. My husband and daughter got the Johnson & Johnson vaccine. They are perfectly fine. And if we go to the next slide, Luis, please. Each of you, as I mentioned, play a role. We all have a role to play, and apologies because I'm repeating the same. But reality is help us spread the word. If you have your own fears, your own concerns, inform yourself. ask questions and ask the questions from trusted sources of information, your doctor, a pharmacist, someone you trust. Oftentimes we turn into our neighbor. And if it happens that your neighbor is well informed, it will give us the right information. But reality is that this virus can act differently in people. Maybe I did get the virus and I don't know because of what Dr. Peralta mentioned earlier. Maybe I'm asymptomatic. When you help us spread the word, weekly social media posts, if you have that kind of reach, Facebook, WhatsApp, we know is quite effective. Please use our hashtags. And here again, I'm mentioning the face-to-face outreach. I have found that face-to-face outreach can be the most effective way to reach individuals, families who don't have access to technology. Unfortunately, a lot of the efforts around vaccine promotion has been done using traditional and social media. Even to get an appointment, you have to have a computer. That's why your voice is so important. Help someone to get an appointment or indicate where that person can go without an appointment, as I did when I went to get my vaccine. If you go to the next slide, Luis, and if you click, please, on the link under Spanish. It's okay. It may be that the link is not working, but if you click on that link, it will take you to our web page, and this digital toolkit is there, available in English and Spanish, and it has a number of really great resources, templates. Again, in English and in Spanish, you can use. We are also about to upload talking points, what we heard this week from those that we've been training. For example, housing counselors, parents, and I'm about to train those working in one of our programs. And the promotores de salud in about 2 or 3 weeks. Is that this template can be helpful in and talking points. For example, they are telling us, how do I say this? What do I need a script? So we are going to upload all of that. Also, you haven't seen the resources that the Ad Council and the COVID-19 Prevention Network have developed. They are excellent. I have used a number of them as a professional in my training efforts with community members. So this is excellent resources. And the last slide, please, Luis. Here is my email. Feel free to reach out. Last time I was sharing this stage with Luis, a number of you contact me, and that is what we would like to see. That is how we know of your needs and how we can better respond to this effort. Thank you. You are mute, Luis.
Thank you, Alejandra, very much. And now we're going to continue the presentation. So we have Guillermo Chacon. I'm going to upload Guillermo's.
I just want to take 4 minutes. You can put the PowerPoint because I know we're running out of time. Let me just share a couple of remarks. and we can share the PowerPoint with everyone. I know we have 122 people and many, many more through Facebook. And I want to allow a little time that we can answer some questions that were placed in the Q&A. I led the Latino Commission on AIDS, and we are founder of the Hispanic Health Network. Our dedication is to advance that Latinos access healthcare. Hispanic Latinx, unfortunately, is estimated that up to 25% nationwide do not have healthcare. That's a problem. The second issue that I want to remind all of us is that we are the second most impacted when we talk about COVID, even though we only represent 18% of the US population. Sad to report to all of you that it's estimated that obviously over 338,000 white non-Hispanics, Anglo folks have died due to COVID, but over 104,000 Latinos, and this is partial data, 1,088 individuals. That when talking about abuelas, abuelos, tías, tíos, cousins, relatives, co-workers. And truly, this is unprecedented, but also I want to sound the alarm that we have issues, and we need to break it down by block, by city, by county, by state, by U.S. territory, especially Puerto Rico, U.S. Virgin Islands, and D.C. Let's put it in perspective. California is 39% our Latino population, but also California represents up to 48% of all COVID cases. We have a problem. Texas, we are 40% of the population in Texas are Latinos, Latinas, but we are 36% of cases. Bottom line is we need to go deeper, get close to the programs, either at the city level, at the county level. The states are the key source of coordination. We need to raise the visibility of this crisis, because don't forget that COVID came on top of many, many other epidemics that we have been fighting in our community. One of them is structural poverty. Our folks are behind at many levels. And when you look every single health indicator, cancer was #1 killer before the pandemic. We need to look at that data now from that perspective. And many other health conditions that really, really has been devastating our communities. We are part also of the National Hispanic Latinx Health Leadership Network, focused on infectious disease and substance use and mental health issues. This national network from Puerto Rico to California is dedicated to address those issues. But all of us right now has been overwhelmingly impacted since last year, 2020, responding to this epidemic. And Dr. Peralta and Alejandra, in Unidos, in Casa Rubén, in the Prevention COVID Network, we are dedicated to respond. But I want to remind you, all of us, that we are dealing as a priority, to try to get as many people vaccinated. And we need to put it like very simple, ABC. We need to talk to people and acknowledge that is a lot of information. Don't forget, when we talk about Latinos, Latinas in the US, we're talking about Latinos that were born in the US and foreign born. And we need to customize and tailor and be inclusive. Afro-Latinos have their challenges, their realities. When you break it down country by country, if you look in the beautiful and large, big city as Mexican Americans are also new immigrants from Mexico, the large majority. And we need to also be mindful about the language. Language justice is not just a statement. We have to break it down to connect and link with those communities. With that, I leave you that we must continue, break it down by city, county, state, mapping the community, engage those pockets of monolingual Latinos, Latinas, in order to really reach the finish line and get ready for another race, as we don't know what is coming tomorrow. But we are very happy to be part of this space, and we encourage all of you to work together and learn from our Native, Black, Asians organizations, as equal among Hispanic Latino entities, from civic to faith-based to business community. Together, we will defeat this epidemic. Thank you.
Thank you very much, Guillermo. Terrell, we can go ahead with the questions if you have any, if you get them, please.
Sure, we have quite a few questions. I think we can start off maybe with Dr. Peralta. There are quite a few questions surrounding vaccine safety and efficacy for pregnant women. So maybe you could provide some insight surrounding that, but also some information as to why we have vaccine age restrictions for youth.
Okay, that's a complex question, but I'll start with I'll make it in two pieces now. One is that the safety of the vaccine during pregnancy. The last study I mentioned, it was in the New England Journal of Medicine. It came from the CDC. It's called the Immunization Safety Office. The director, Shimabukuro, was the lead author when basically the CDC is looking at the smartphone data, VSafe, and the vaccine adverse event reporting system, which is what I call VAERS, and this is what anybody can report on. So they looked from December of 2020 last year to February 28th, and they looked at anybody who was pregnant who had been fully immunized with the Pfizer and the Moderna. And the bottom line with the analysis is that the pregnancy and the neonatal outcomes, meaning when the baby's already born, including the miscarriage, stillbirth, preterm birth, congenital anomalies of the baby that someone mentioned in the chat, or the small size for gestational age, meaning if the baby's born very small, or neonatal death were examined. And there were no significant changes to the reported when people have had no vaccine. So that was the great news that the director of the CDC expressed on TV. And I'm not even quite sure why she got in trouble, because this is a New England Journal of Medicine from her own office. And, you know, the interesting thing about this is not only that people, you know, the CDC has said that it's safe, but one of the areas here that they also looked at is after the baby was born, they follow up. Remember, most of these vaccines have been studied in trials, but now we do have trials and we have registry specifically for pregnant women. So we are going to find even more information about that. But the American College of Obstetrician and Surgeons indicate that the risk of a pregnant woman to develop complications of COVID, and we know that from previous studies, a lot larger than getting the vaccines. So we know that they get admitted with more severe disease, and the complications are many. So this is why, especially if you are beyond the first trimester, talk to your doctor, inform yourself with the guidance of your doctor, and then you are eligible to the vaccine if there's no complications with you. In terms of restriction of age, it's just right now the trials that are available, again, for Pfizer above 16, and for the other two above 18. But those trials from 12 to 15 and through 17 are not ready yet. So this is what we're waiting for in the month of this month and next month.
Oh, thank you, Alicia. I think this question I heard before, and I think Guillermo or Alejandra can reply. Last week, a mayor in Miami had a backtrack and apologized for the statement that announced vaccinations for non-residents, tourists, and undocumented immigrants. What news and hope do we have for our families that still live in Latin America and are trapped in countries with high mortality and basically no access to vaccine? What can we do to help our loved ones?
That is a really good question. You all can see that I have an accent. I was born and raised in Chile, where we have a high vaccination rate. Chile was one of the countries that bought vaccines the fastest. other countries that surround Chile haven't had that privilege for a number of factors. The short answer, anyone living or coming into US territory, there are no residence requirement when I went to get my vaccine. I had already pre-registered. There are places where you don't need an appointment. I'm not saying that everyone who is overseas should come here because that is not realistic, but that is how it's working here. I do encourage governments across the world to make their citizens' health a priority and get vaccines when available, because reality is there are not vaccines for all around the world, unfortunately. So thank you for the question. It's a really good and what I found profound question.
Yeah, I just only want to add that, a mayor usually, the immediate tendency will be to assist, to respond. And I agree with Alejandra. It's and encourage folks that are attending this session that it's an ongoing campaign, globally speaking, by the UN to distribute vaccines throughout the world. But if anybody have a relative that, their home is the US, we need to encourage them to return and to get vaccinated for sure. But also, I truly believe that we need to be mindful, and I'm sure the COVID response at the White House level will be looking into any development, because again, US is not an island, we're part of the world, and it's a commitment in the US to support, and the US has been sending vaccines to other neighbor countries. But I truly believe that, again, we need to reach not only herd immunity in one country, but, globally. And if you ever go to Chile, anyone go to the island of Chiloé. It's beautiful.
Lorena, any other question that you have?
Yes. So could someone provide some insight on mask requirements after being vaccinated?
The CDC just the CDC director did update the guidelines. If you're fully vaccinated and you are in the public, you don't have to wear. Obviously, I encourage people, if you have suffered from allergies, keep using the mask. And also keep it handy, because if you go to many locations, they will require, not everywhere in the US, but in a lot of places, they will ask you to wear a mask to access a shopping mall or a restaurant until you are sit down and you enjoy your meal.
And just to add one point, that if you go outdoors in non-crowded places, many of our families go to soccer games. This is one of the favorite pastimes, and we don't know who's vaccinated there, who's not. If you are on a bench with many other people, this is trouble regardless. But we do know, like you say, Guillermo, indoors, this is one of the areas where you have a much better chance of getting infected, or is contagious, right? And there are beautiful studies that even came out this week, even from my own alma mater, MIT, in terms of, the risk of with new variants of how high the transmission is indoors.
Can anyone recommend tools to address vaccine hesitancy? It is a huge amount of Hispanic community in Northeast Florida. It's anonymous.
Maybe we can follow up and send that information, Jefe.
Okay, yes. We are running out of time. It's 3:05 already. So I want to thank everybody for attending this webinar, and the presenters. Thank you very much for agreeing to come to present information on this topic that is very important at the moment. So we're going to end up now. Thank you very much, everybody, and see you next time.
Thank you. Be safe, everyone. Please wear masks and get vaccinated. Please.
Yeah, thank you. Yes.
Take care.